The last tool that we're going to be talking with you about is health and behavioral assessment. I already referenced a few minutes ago how critical it is that if you're going to have quality in life, that you're healthy, that you're safe, that you're free from abuse and neglect. Ultimately, when we're talking about health, it has to do with a whole bunch of different things. As part of the Delmarva contract, we have a nurse reviewer who is on staff with us. Her name is Linda Tupper, and she is a registered nurse with over 30 years experience just working with people with developmental and intellectual disabilities. She put together a health and behavioral questionnaire that's pretty detailed. It's handout number 23. The IQ that I went through was handout number 22 that you had. Handout number 23 is the health and behavioral assessment. We want to get at, are you seeing doctors and specialists, and who are they? Do you have a dentist? Do you take any medications? Do you get physical or speech therapy or any nutritional therapies? Are you someone who maybe needs some behavioral supports, that you might have some behavioral services in place? Have there been any changes in your health status? Changes in health status would mean, how have you been feeling for the past year? Have you lost a lot of weight all of a sudden? Have you just not been feeling well? If you're a person who happens to maybe have a seizure disorder, have your seizures gotten worse in the past year? Whatever it might be with regard to you and your health history, this questionnaire is going to cover it. We ask about insurance, Medicare, private pay. As part of our contract with Delmarva and working with the state, we are able to view Medicaid claims and see if folks are getting any doctor services through the Medicaid system or getting prescriptions prescribed by paid for by Medicaid. We can't see if the private insurance or Medicare. So we ask if you have those other things, because it would help explain maybe why we're not seeing claims data for Medicaid. Just to take you through the health and behavioral assessment, it's a medical peer review is used to determine if. So the questionnaire that the reviewer is going to ask on site, we're going to ask you about your physical, dental, and behavioral health, see if it meets what we call professionally recognized standards of health care. What that would mean is typically for dental, hopefully you're seeing a dentist at least once a year for a cleaning, a checkup. If you have pain or discomfort, are you going to see a dentist when you need to? Have you been for an annual checkup? Health really is driven, what checkups you need and what you need to have depends on how old you are, what gender you might be if you're male or female, what the nature of your health history is, and your age. As you get older, unfortunately, many of us need to go to the doctors more and have to get some more checkups and some more tests. Health can be something that you do on a preventive basis, meaning you go to the doctor and you take certain tests and screenings in order to make sure that your body's healthy and that you're in good shape. Sometimes we go to the doctor because we're not feeling well, and we need to see the doctor because something's hurting us or bothering us. Whatever that might be, the questionnaire that this has, handout number 23, is like. Maybe based on the conversation we had about your health, we may have learned that you've lost a lot of weight recently. Maybe you've been to the emergency room a couple of times, your appetite's not the same as it used to be, you're not feeling very well. Those might be some things that would be considered a red flag. The Delmarva reviewer at that point in time might decide, maybe I need to give Linda Tupper a call and ask her a few questions, and Linda's available to any of our reviewers. She's a phone call away, and we can go ahead and give her a call and talk with her. We might forward some information on to Linda, and she might decide to call an area nurse case manager, depending on where you live. There's an area office for APD, and they have nurse case managers. So if there's some issues maybe we saw with medications that you're taking, or some concerns with your health, or you can't find the doctor or the specialist that you need to in your area, maybe we can get involved with the nurse case manager and try to troubleshoot and help you a little bit with getting a little bit better health for you. Area behavior analyst might come up if you're someone who's needing some behavioral services or supports. Maybe you have some challenges with your behavior and how you feel at times. Maybe your family needs some support with understanding why you might do certain things the way that you do them. There are behavior analysts that can help with that part. And there's an area behavior analyst that can intervene if we need to call them as a possible source for follow-up. Typically, when we're talking with people about their health, we're gathering the information. The questionnaire you'll see is very involved and very complete. It covers lots of pieces of information. Based on how a reviewer answers those questions, it could generate what we call some discoveries in your person-centered review report. So if we might indicate that you haven't been to a dentist in the past 12 months and that your teeth are hurting, there'll be a little discovery on the bottom of your person-centered review report that will say, individual hasn't been seen by a dentist in the past 12 months. Individual indicates that their teeth are bothering them. That discovery that goes out to your support coordinator, to the local area office, a copy for you if you request it, may help people to intervene and assist you with something that you need some help with. So any of the information, the health questionnaire can get pretty involved depending on the nature of your disability. If you are a person with cerebral palsy and you use a wheelchair and you have to be positioned a certain way in that wheelchair, you need environmental modifications around your home, maybe you also have a G-tube that you do feedings on, that would be more involved medical care, and we would ask those questions. If you're someone who's generally in good health, doesn't take any medications, is young, is healthy, we'll move through this questionnaire pretty quickly. But we have found, I've done many interviews around the state of Florida with lots of people, and healthcare is really challenging sometimes. Some folks live in very rural areas, they can't fund the doctors, Medicaid doesn't pay for the services that they need. It really can be challenging. We want to find out what's going on. If there are red flags or areas of concern, make the proper phone calls, get you the help that you need. But this information really gives us a good picture for how health is being supported for individuals in the state of Florida. The service-specific record review, after we finished our conversation with you, as I said, we're going to look at the paperwork. For CDC Plus participants, we're going to look at your consultant's file, and we're going to look at your representative's file for certain paperwork pieces. We want to make sure that they're keeping the documentation that they need to have according to the rules and the handbooks that they follow. That becomes important because for these programs to be successful, there has to be a showing that people are kind of following along and have the documentation that they need. We want to show that the program's in compliance with requirements, rules, and policy. The state of Florida has to answer to the federal government for any Medicaid-funded programs. Delmarva, as a QA entity, is just doing the discovery to see that folks are in compliance, so that these programs can continue to expand and succeed in Florida, because we can show that people are doing what they need to do. For a person-centered review report, you as the person, if you participated in the interview, or your family members can request a copy of the report, we'll send one to you. A copy is automatically sent to your support coordinator or to your consultant, and they get a copy of your PCR report. It's going to have on there the services that you're getting. For CDC, it's pretty straightforward. You get a CDC representative and you have a consultant. It'll have the results from the I-cubed. There were 12 elements in the I-cubed, so it might have that 7 out of those 12 were a yes. Maybe the elements in there that you needed more support with were understanding your rights, developing more community roles, and understanding more about choices and services and providers. Whatever it might be, the I-cubed information is part of that report. It will also have the discoveries based on the information that we gathered in the health and behavioral questionnaire, or possibly in our conversation with us, you told us how you really want a job and that you want to be able to get out there and earn your own money. So we might have a discovery that says, you know, Johnny indicated he really would like to get a job and earn his own money. So we're just putting that out there. It's telling your story. It's saying what's important to you as a person and how are your services going. So that's what the PCR report is about. A copy of your report, again, is also available for the APD office, Agency for Persons with Disability, both locally and up in Tallahassee, and then ACA, Agency for Healthcare Administrators. They're the ones who are the ACA holds a contract with Florida. APD is someone we work in partnership in reviewing their services. So they get copies of the reports and can view and get an idea just how things are going for people in the state of Florida. We talked about this in the other PowerPoint, but again, this is our customer service representative, Beth Townsend Strategeas. You can reach her toll-free at 1-866-254-2075. Again, that's a toll-free number. We have a fax, and that is area code 813. We're in the Tampa area, 977-0027. And then Beth's email is town, TOWN, SEE@dfmc.org, and then Delmarva's website, the I-cubed, the health and behavioral questionnaire, all that information is up there for people to look at, and there's a link for the National Core Indicators. We can't hand out a copy of their survey, but there is a link to take you to their website and information about their services as well. And again, that handouts are posted with this video. But our website is www.dfmc-florida.org. Thank you very much. That wraps up the PCR part for CDC folks in the CDC Plus